That's an interesting point. Eric, do you agree? And do you find your students not putting enough force? And how do we know how much is enough force on manual testing?
Yeah, yes. So I do use lots of force. Chad's correct. Always have. I do find that students um, are afraid to because they don't want to hurt the patient, and I think that's wonderful of them. I also think you have to balance that with we're primary care practitioners and people are coming to you looking for perhaps a diagnosis and an intervention plan, and I don't know how. If all of your tests are murky because you're afraid to touch the patient or hurt them, then I don't know how you ever get, like, your chances of getting an accurate diagnosis are completely shot at that point. You're just not going to do it. How do I do the test? I mean, I really do exactly what Chad suggested, which is I will use, and I try to use the same hand, by the way, or sometimes a similar muscle group. So so for example, if I'm going to test the patient's left shoulder with my right hand, I will typically go and test the right shoulder with my right hand also, so that at least I'm trying to make more reliable the force I'm using, because I have a stronger right arm than I do left arm because I'm right-handed, right? So I'll try to do things like that, and I do it repetitively to see can they recover from that initial strength test. And it is a break test. It's a full-on, you have to hold it for 3 seconds and not 1 second, but I try to hold it a little bit longer to see if they can. So that's how I've modified my strength testing. And if it's something like, I don't know, if we're testing the interosseous muscles of your digits in your hand, I try to use my interosseous muscles to test that, as opposed to using my full grip strength, because my full grip strength it's not a fair test. There isn't anybody who can, if I'm squeezing with my full hand, can actually resist with their interossei muscle. So they all test as roughly the same. So do I know for sure that any of those things matter? I suspect that they do, but I don't know. But that's how I've learned to modify how I manual muscle test. I'd like to hear Chad's thoughts on that, though. Maybe I'm wasting my time, Chad.
No, Eric, I think you're spot on. If we think about most of our musculoskeletal conditions, they don't just happen, right? There's a sojourn phase where it builds up until it gets to the point where the patient starts experiencing symptoms and exhibiting signs related to that condition. And radiculopathy is a perfect example. It will often be subthreshold. It will be there, but it won't exhibit anything signs and symptoms wise. So when you're working on that early phase of that disease process, not the later phase where somebody's really severe, but that very early phase, you have to be fairly aggressive with your testing to really tease it out. Otherwise, what you're going to end up with is just getting a false negative and missing that particular diagnosis with that patient.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.